Every single morning, millions of people over 60 do something that feels completely healthy. They wake up, they feel that familiar stiffness, and before they do anything else, they drink a large glass of cold water, take their medications, maybe swallow a handful of vitamins, and then they sit down to a bowl of oatmeal or whole grain toast. They feel virtuous, they feel responsible, they believe they are protecting their heart. They are wrong. Not about all of it, but about a specific sequence of decisions made in that first 60 minutes after. Waking decisions that research from the American Heart Association and cardiologists at Johns Hopkins have flagged as genuinely dangerous for people over 60. There is a pattern of morning behavior that accelerates arterial stiffness, spikes cortisol to dangerous levels, disrupts the delicate sodium-potassium balance your heart depends on to maintain rhythm, and triggers inflammatory cascades that accumulate damage over months and years. I am going to tell you exactly what that pattern is. I am going to explain the biochemistry, not in vague terms but in specific, precise language, because you deserve to understand what is happening inside your body, not just be handed a list of rules. And I'm going to give you a replacement morning routine, step by step, that takes less than 20 minutes and that cardiologists at major research institutions have connected to reduced cardiovascular events in patients over 60. But I need you to stay with me, because the most dangerous part of this morning mistake is something I will reveal about 30 minutes into this conversation, and it is something that virtually every mainstream health source is still getting wrong. Let us start with what happens to your cardiovascular system between 2 and 8 in the morning, because this window is not neutral. Your body is not simply resting. It is executing a carefully orchestrated hormonal and neurological transition that your heart is extraordinarily sensitive to. In the early morning hours, your sympathetic nervous system begins to activate. Cortisol, your primary stress hormone, starts rising sharply around 3 or 4 in the morning, reaching its peak shortly after you wake. This is called the cortisol awakening response, and its purpose is legitimate. It mobilizes glucose, raises blood pressure gently, and prepares your cardiovascular system for the demands of waking life. Simultaneously, your body releases catecholamines, specifically epinephrine and norepinephrine, which cause your heart rate to increase, your blood vessels to constrict, and your blood to become temporarily more viscous and prone to clotting. This is why the majority of heart attacks and strokes do not happen at midnight. They happen between 6 and noon. This is documented extensively in cardiovascular literature, including a landmark study published in the journal Circulation that tracked over 4,000 cardiac events and found peak incidence in the morning hours was not random. It was mechanistic. Now here is where the mistake enters. During this window of elevated cortisol, increased vascular resistance, and heightened clotting tendency, what you eat, what you drink, how you move, and critically, how quickly you move, either works with this physiology or against it. The single most common mistake seniors make in the morning is not a food, it is not a drug, it is not even a habit most people think of as health-related. It is the speed of transition from horizontal to vertical, combined with immediate consumption of high glycemic carbohydrates and suppression of the body's natural morning hydration signal. Let me break this down precisely. When you have been lying down for 6 to 8 hours, your cardiovascular system has adapted to horizontal circulation. Blood pressure is lower. Your baroreceptors, the pressure-sensitive nerve endings in your carotid arteries and aortic arch, have adjusted their baseline. The volume of blood pooled in your lower extremities is redistributed. When you stand up quickly, particularly if you are over 60, your autonomic nervous system must execute an immediate compensatory response to prevent blood pressure from dropping too sharply. This is called orthostatic regulation, and it requires a healthy, responsive autonomic nervous system to execute correctly. After 60, autonomic responsiveness declines. The baroreceptors become less sensitive. The vessels are stiffer due to years of accumulated collagen, cross-linking in the arterial walls, which means they cannot constrict as quickly or as effectively. The result is orthostatic hypotension, a sudden drop in blood pressure upon standing, which in its mild form causes dizziness and brain fog, and in its more serious form causes falls, transient ischemic attacks, and in some cases triggers cardiac arrhythmias in people who already have underlying conduction abnormalities. Studies show that over 30% of adults over 70 experience clinically significant orthostatic hypotension. Most of them do not know it. They attribute the morning dizziness to age, to not sleeping well, to dehydration, and then they rush to fix the dizziness by doing the exact things that compound the cardiovascular stress. They drink coffee immediately. Caffeine, consumed within the first 30 to 45 minutes of waking, lands on a cortisol system that is already at or near its daily peak. Your cortisol awakening response is a finite, self-regulating mechanism. When it peaks, the body begins to downregulate cortisol production through negative feedback. Caffeine at this stage does not enhance alertness. Your cortisol is already doing that. What it does instead is block adenosine receptors, while simultaneously stimulating additional catecholamine release, which means you are compounding sympathetic nervous system activation on top of an already activated system. Blood pressure rises more sharply. Heart rate variability, one of the strongest predictors of cardiovascular health and mortality, decreases. And because you have blunted the adenosine system early, when cortisol does begin to fall 2 to 3 hours later, the adenosine flood is disproportionately large, producing the mid-morning energy crash that sends people back to caffeine, creating a cycle that dysregulates the cortisol rhythm for the entire day. But the caffeine issue is secondary to what cardiologists are more specifically concerned about. I will return to what that primary concern is in a moment, because I want to first explain what happens with the carbohydrates. The majority of seniors eat breakfast within 30 minutes of waking, and the majority of those breakfasts are what nutritionists classify as high glycemic: oatmeal with fruit, whole grain toast with jam, cereal, orange juice, a banana. These foods are widely marketed as heart healthy, and in certain contexts, eaten at certain times. Some of them are, but consumed in the morning in the context of an already cortisol-elevated, catecholamine-activated cardiovascular state, they trigger a glucose spike that the body responds to with a sharp insulin surge. Here is why that matters specifically for your heart. Insulin is not just a blood sugar regulator. It is a vascular hormone. Insulin receptors are present throughout the endothelium, the thin cellular lining of your blood vessels. And when insulin surges, it activates signaling pathways that include mTOR and FKB, both of which promote inflammatory gene expression in the vascular wall. In young, metabolically healthy individuals, this insulin spike is brief, the inflammation is transient, and the system recovers quickly. In adults over 60, particularly those with any degree of insulin resistance, which affects the majority of people in this age group even in the absence of diabetes, this spike is larger, longer, and the inflammatory signal is proportionally louder. You are flooding an already stressed vascular system with an inflammatory signal every single morning before 8 a.m. Over days, this is unremarkable. Over months and years, this is how plaques grow. This is how endothelial dysfunction deepens. This is how arterial stiffness accelerates beyond its natural aging trajectory. Now I want to tell you something that will probably surprise you, because it surprised many of the cardiologists who began examining this pattern closely. The solution is not complicated. It does not require expensive supplements. It does not require a radical dietary overhaul. It requires a precise restructuring of the first 60 minutes of your morning, based on your body's actual biochemical state at that time rather than on cultural habits about what breakfast is supposed to look like. And the most powerful single chain The one that cardiologists at institutions including the Cleveland Clinic and Stanford's Cardiovascular Research Division have connected to meaningful improvements in blood pressure, heart rate variability, and vascular inflammation markers, is one that most people would never think to call a health intervention. I am going to tell you what it is, and then I am going to walk you through the complete morning framework, including the specific foods, the specific timing, and 2 recipes that you can start tomorrow. But first, I want to tell you about Margaret. Margaret was 67 when she came to her cardiologist for a routine follow-up after a mild heart attack 18 months earlier. She had done everything right by conventional standards. She had cut the red meat. She was eating her oatmeal every morning. She was taking her statins and her beta blocker without fail. She walked 20 minutes every afternoon. Her LDL was controlled. Her doctor was satisfied. But Margaret was exhausted by 10 in the morning every day. She had persistent low-level chest tightness that her doctors attributed to anxiety. Her sleep was fragmented. She had gained 11 pounds in the year since her heart attack despite eating, by every metric, healthily. And her heart rate variability, the measure her cardiologist had started tracking as a predictor of future events, was declining. What Margaret's cardiologist eventually identified was not a medication problem or a dietary failure in the traditional sense. It was a morning physiology problem. Margaret was waking at 6, standing up quickly, going directly to the kitchen, brewing coffee and drinking it before 7, eating her oatmeal with a banana and a glass of orange juice by 7:15, and then sitting at her kitchen table reading the news. Every element of that sequence was doing something specific to her cardiovascular system that her afternoon walk was insufficiently powerful to counteract. When her cardiologist restructured her morning, not her entire life, just her morning, her heart rate variability improved measurably within 6 weeks. Her morning chest tightness resolved. Her energy stabilized. She lost 4 of those 11 pounds without changing anything else. Margaret's story is not unusual. It is, in fact, extremely common. And the reason it is not more widely discussed is that cardiology, as a field, has historically focused on pharmacological intervention and on the big-picture dietary patterns: Mediterranean diet, reduction of saturated fat, without getting granular enough about timing and sequencing, which is where the actual damage is often being done. Let me now walk you through what the research suggests a cardiovascular protective morning actually looks like. The first recommendation sounds almost insultingly simple, which is why people consistently underestimate it, and why it consistently appears in the research as one of the highest leverage interventions available to seniors. Do not stand up immediately when you wake. This is not about laziness. This is about orthostatic physiology. Spend 2 to 5 minutes in transition. Sit on the edge of your bed. Let your legs hang. Take slow, deliberate breaths. Your baroreceptors need time to recalibrate to the vertical position. Your blood pressure needs time to adjust. This simple act, 2 to 5 minutes, measurably reduces the orthostatic hypotension risk, reduces the catecholamine surge associated with abrupt postural change, and decreases the morning spike in platelet aggregation that contributes to the elevated clotting risk of the early morning hours. While you are sitting at the edge of your bed, before you have coffee, before you eat, drink 8 to 12 ounces of room temperature water, not cold water, and this distinction matters more than you might expect. Cold water consumed rapidly in the morning activates the vagus nerve in a way that can trigger bradycardia, abnormally slowed heart rate, in individuals with pre-existing conduction abnormalities. It also causes esophageal spasm in a subset of older adults, which is frequently mistaken for cardiac chest pain and which creates anxiety. That activates the sympathetic system. Room temperature water, sipped rather than gulped, rehydrates the plasma after the overnight fast, reduces blood viscosity, which is elevated after 6 to 8 hours without fluid intake, and gently activates the gastrocolic reflex without thermal shock to the system. The second recommendation concerns caffeine timing, and this is where the research is most specific and most consistently ignored. Do not drink coffee or caffeinated tea in the first 90 minutes after waking. I understand that this feels impossible for most people. I understand that the morning coffee is not just physiological, it is ritual, it is comfort, it is identity. I am not asking you to give it up. I am asking you to delay it by 90 minutes, and the reason is precise. Your cortisol awakening response peaks between 30 and 45 minutes after waking and begins declining after 60 minutes. When you consume caffeine after the 90-minute mark, you are supplementing a cortisol system that is already declining, which is the appropriate role for caffeine. It extends alertness by blocking adenosine during the natural energy trough, rather than amplifying a hormonal system that is already at maximum. Blood pressure response to caffeine is significantly blunted when consumed after cortisol has begun to fall. Heart rate variability, which decreases with early caffeine consumption, is preserved when caffeine is delayed, and the adenosine rebound, the mid-morning crash, is substantially reduced because you have not disrupted the early adenosine accumulation that was naturally self-regulating. A study published in Neuroscience and Biobehavioral Reviews examining cortisol-caffeine interactions found that habitual early coffee consumption actually reduces caffeine's efficacy as an alertness tool because the body upregulates adenosine receptor density to compensate for chronic early receptor blockade. You are, in other words, making your coffee less effective by drinking it too early, while simultaneously compounding your cardiovascular stress. The third recommendation concerns breakfast composition, and this is the area where the mainstream health message is most dangerously incomplete. The goal in the morning is to avoid a sharp glucose and insulin spike, particularly during the window when cortisol and catecholamines are already elevated. Because the combined effect of cortisol and insulin on vascular inflammation is not additive, it is synergistic. Cortisol sensitizes the vascular endothelium to insulin-driven inflammatory signaling. This means a glucose spike in the morning, in the context of elevated cortisol, produces disproportionately more vascular inflammation than the same glucose spike at noon or in the evening. This means oatmeal with banana and orange juice, all individually defensible foods combined in the morning, in the cortisol window, produces a glycemic and inflammatory response that is significantly more damaging than the same foods eaten at 2 in the afternoon. What should replace it? The research converges on a breakfast that is high in protein, moderate in healthy fat, low in rapidly digestible carbohydrates, and rich in potassium and magnesium, the two minerals most directly involved in cardiac electrical conduction and vascular smooth muscle tone. I want to give you two specific options that you can start using immediately. The first is what I call the cardiac morning bowl. 2 whole eggs scrambled in 1 teaspoon of extra virgin olive oil, cooked on low heat to preserve the phospholipid integrity of the yolk. 1/2 of an avocado, sliced, providing approximately 500 milligrams of potassium and 14 grams of monounsaturated fat that actively supports endothelial function. A small handful of walnuts, roughly 1 ounce, which are the only nut with significant alpha-linolenic acid content, an omega-3 precursor that reduces platelet aggregation and has been associated in multiple trials with reduced cardiovascular mortality. Optional: 2 tablespoons of full-fat Greek yogurt, which provides additional protein and the probiotic strains, Lactobacillus acidophilus and Bifidobacterium, both of which have been connected in emerging research to reduced systemic inflammation via the gut-heart axis. This meal produces a slow, shallow glucose response. Insulin rises modestly and briefly. The cortisol-insulin inflammatory synergy is largely avoided, and the potassium and magnesium content actively support the cardiac electrical gradient, the sodium-potassium pump that maintains the action potential across cardiomyocytes, the individual muscle cells of your heart. The second option is for people who genuinely cannot face solid food in the morning, which is common among seniors because gastric motility slows with age and the sensation of morning hunger is frequently blunted. Morning cardiovascular smoothie: 8 ounces of unsweetened almond milk as the base, 1 tablespoon of ground flaxseed, which provides both omega-3 fatty acids and lignans that have been shown to reduce arterial stiffness in postmenopausal women specifically. 1/2 cup of frozen wild blueberries, not cultivated blueberries, wild, because wild blueberries contain up to twice the anthocyanin concentration of cultivated varieties, and anthocyanins are among the most potent dietary activators of nitric oxide synthase, the enzyme that produces nitric oxide in the endothelial lining of your arteries. Nitric oxide is the primary vasodilator your body produces endogenously. It is what nitroglycerin mimics pharmacologically in angina treatment. Dietary promotion of nitric oxide production through anthocyanins and arginine-containing foods is one of the most evidence-supported nutritional strategies in cardiovascular medicine. Add 1 tablespoon of almond butter for protein and fat to blunt the glycemic effect of the fruit. If tolerated, a small pinch of sea salt, and this requires explanation. After an overnight fast, plasma sodium is relatively concentrated relative to intracellular fluid, but total plasma volume is reduced due to respiratory and transdermal water loss during sleep. The sodium-potassium balance is critical for cardiac rhythm. Many seniors are on diuretic medications that deplete both sodium and potassium. A small amount of sea salt in the morning, specifically sea salt rather than refined sodium chloride, because sea salt contains trace magnesium and potassium that refined salt strips, supports plasma volume repletion, and helps maintain the electrochemical gradient across cardiac cell membranes. This is not a recommendation to increase overall sodium intake. It is a recommendation for strategic morning sodium that supports cardiac electrical stability specifically. Now I want to come back to the most dangerous part of the morning mistake, the part I promised to return to, because everything else I have told you, the orthostatic hypotension, the caffeine timing, the glycemic response, those things matter. But this matters more. The most dangerous morning mistake seniors make is chronic, low-grade dehydration entering the cortisol awakening window, combined with immediate engagement of the sympathetic nervous system. Through stress-activating media, you wake up. You are already mildly dehydrated after 8 hours without fluid. Your blood is viscous. Your platelets are sticky. Your clotting factors are upregulated. And before you have given your cardiovascular system any of the protective inputs I have described, before the water, before the slow postural transition, before the protein-rich breakfast, you pick up your phone. You look at the news. You look at email. You look at social media. And within 60 seconds, your amygdala, the brain's threat detection center, is processing images and headlines and social signals as if they were physical threats, because evolutionarily, that is all it knows how to do with threatening information. It does not distinguish between a disturbing news story and a predator. It activates the hypothalamic pituitary adrenal axis. It drives additional cortisol secretion. It spikes norepinephrine. And it does all of this on top of the cortisol awakening response that was already underway, on top of dehydrated, hypercoagulable blood, on top of a cardiovascular system that has not yet had the protective inputs it needs. The research on morning cortisol amplification through negative media exposure is not speculative. Studies from the University of California examining cortisol response to negative news media found that individuals who consumed distressing media in the first hour of waking had cortisol awakening responses that were significantly elevated compared to control groups. and that this effect was measurable through salivary cortisol assays taken 90 minutes after waking. The effect was pronounced specifically in older adults, in whom the cortisol feedback loop is already less responsive. You are, every morning, if you follow the common pattern, subjecting your cardiovascular system to a compound insult. Dehydration-driven hyperviscosity, abrupt postural hypotension, caffeine-amplified sympathetic activation, glucose and cortisol inflammatory synergy, and amygdala-driven cortisol amplification, all within the 60-minute window when your cardiovascular risk is statistically and mechanistically at its highest. The restructured morning I am describing asks you to replace that pattern with 5 things. 2 to 5 minutes of seated transition at the bedside before standing. 8 to 12 ounces of room temperature water before anything else. No phone, no news, no email for the first 30 minutes. A protein-rich, low-glycemic breakfast from one of the 2 recipes I described. Caffeine, if you want it, 90 minutes after waking. That is the entire intervention. 20 minutes of restructured behavior in the morning that works with your cardiovascular physiology, rather than against it. I want to add one more element because it is supported by evidence specifically in the senior population, and because it is the element that most dramatically affects heart rate variability, the single best real-time measure of cardiovascular resilience. 5 minutes of slow, controlled breathing before breakfast. Not meditation necessarily, though if you meditate, this is when to do it. Simply breathing at a rate of 5 to 6 breaths per minute, which means roughly 5 seconds inhaling, 5 seconds exhaling, activates the baroflex, the same system I described earlier that governs orthostatic blood pressure regulation. Slow breathing at this pace drives parasympathetic activation, the rest and digest system, directly through vagal afferent signaling. It physically counteracts the sympathetic tone of the cortisol awakening response. Heart rate variability increases measurably within the first 2 minutes of this breathing pattern. Blood pressure drops modestly. The endothelium, which responds to both mechanical shear stress and autonomic tone, shifts from an inflammatory to an anti-inflammatory profile. This is not a soft, feel-good recommendation. The physiological mechanism is documented. The clinical effect in seniors has been studied in randomized controlled trials. A study published in the Journal of Human Hypertension found that 8 weeks of slow breathing practice for 15 minutes per day reduced systolic blood pressure by an average of 9 millimeters of mercury in hypertensive adults, an effect comparable to a low-dose antihypertensive medication. 5 minutes, not 15. 5. Every morning before you eat. After your water, seated comfortably. That is what I am asking. Let me bring this together one final time, because I want you to leave this video with something actionable, not just information. Every morning, your cardiovascular system wakes up in a state of elevated risk. Cortisol is high, blood is thick, vessels are stiff, clotting factors are primed. Orthostatically, you are vulnerable. This is not disease, this is physiology. But it is physiology that demands respect, particularly over 60, when the compensatory mechanisms are slower, weaker, and less forgiving of repeated insult. The morning mistake is not one dramatic thing. It is a cluster of small decisions. Standing up abruptly, drinking coffee immediately, eating high glycemic carbohydrates, consuming distressing media that individually seem harmless. That together create a morning-long cardiovascular stress pattern that accumulates over months and years into the very outcomes we fear most. The heart attacks, the strokes, the arrhythmias, the progressive heart failure that we attribute to age but that are, at least in part, attributable to what we do. In the first hour after we open our eyes, you can change this. You do not need a prescription. You do not need to overhaul your life. You need to restructure 60 minutes, 5 simple changes beginning tomorrow morning. Sit before you stand. Drink water before coffee. Breathe before you eat. Eat protein, not sugar. Protect your cortisol window from the news. Your heart has been trying to tell you this. It has been telling you through the morning dizziness, through the mid-morning exhaustion, through the chest tightness that comes and goes, through the sleep that never quite feels like enough. It is not aging. It is a system under unnecessary correctable stress every single morning, asking for something different. Now you know what different looks like.